Lieutenant Sara Chen stood frozen in the middle of the field hospital tent, staring at the empty bed, where her first patient had just died. Blood still stained the sheets. Medical equipment beeped uselessly beside the vacant space. The smell of antiseptic mixed with something heavier. She was 24 years old, fresh out of medical school, 6 weeks into her first deployment, and she had just watched a soldier die on her table despite everything she tried to do. Her hands were still shaking, still covered in his blood, still feeling the moment when his pulse stopped under her fingers and did not come back. The other medics moved around her with practiced efficiency, cleaning up, preparing for the next casualty. They had seen this before, done this before. Sara had not. She walked outside the tent on unsteady legs, made it 3 steps before her knees gave out. She collapsed against a supply crate and broke down, sobbing, gulping air, shoulders shaking with the weight of a life she could not save. Other soldiers walked past. Some looked away uncomfortably. Some shook their heads. Too weak for combat medicine, they whispered. Cannot handle the pressure. Should have stayed in a civilian hospital. Sara heard every word through her tears. But she did not know that in less than 24 hours 12 casualties would arrive at once. A mass casualty event that would push every medic past their limits. And the weak nurse who cried would work for 16 hours straight, without breaks, without food, without stopping, saving every single life that came through those tent flaps. Before we begin, make sure to subscribe so you never miss these true tales of courage, and tell us in the comments, where are you watching from today? Sara Chen grew up in a family of doctors. Her father was a surgeon. Her mother was a pediatrician. Her older brother was finishing his residency in emergency medicine. Medicine was the family business. The dinner table conversation, the expectation placed on Sara from the moment she could understand words. She loved it, not because of family pressure, but because healing people made sense to her. The human body was a puzzle. Disease and injury were problems with solutions. Every patient was a challenge she wanted to solve. Medical school was brutal. 4 years of endless studying, sleepless nights, constant testing, the pressure to be perfect. Sara thrived anyway. Graduated top of her class. Had offers from prestigious hospitals. A guaranteed future in civilian medicine with good pay and normal hours. Then she surprised everyone by joining the army. Her parents were horrified. You went to medical school to save lives, not to go to war zones. That is exactly why I am going, Sara said. The soldiers who need doctors most are the ones who cannot get to hospitals. I want to be there when it matters most. Her father tried one more time. Sara, you are a brilliant doctor, but combat medicine is different. It is not clean, not controlled. People die despite your best efforts. Can you handle that? Sara believed she could. She had studied trauma medicine, practiced emergency procedures, read every manual on battlefield medical care. She thought she was prepared for anything. Basic training was hard. The physical demands, the yelling, the constant pressure to be tougher than she felt. But Sara pushed through, made it to medical officer training, learned how to treat gunshot wounds, blast injuries, traumatic amputations. In training, the patients were dummies, realistic but not real. When you made a mistake, you reset and tried again. Nobody died in training. Sara deployed to Afghanistan 6 months after finishing her training. She was assigned to a field hospital at Forward Operating Base Salerno, a busy place. Frequent casualties, exactly what she had trained for. The senior medical officer, Major David Park, was a veteran of 3 deployments. He saw the eagerness in Sara's eyes and gave her advice she did not fully understand yet. Lieutenant, your training prepared you for the medicine, but nothing prepares you for the first time you lose someone. When it happens, and it will happen, do not let it break you. Grieve. Learn. Move forward. That is how we survive this job. Sara nodded. Thought she understood. She did not. Not until Private James Miller came through those tent flaps with a chest wound that should have been survivable. Private Miller was 19 years old. Shrapnel from an IED had torn through his left side. Punctured lung. Internal bleeding. Critical, but treatable if they moved fast enough. Sara was the first doctor to reach him. She started barking orders immediately. Chest tube, blood transfusion. Give me a surgical kit now. Her hands moved with practiced precision. Everything she had trained for. Every procedure she had memorized. Miller was conscious, looking up at her with wide, terrified eyes. Am I going to die? No. Sara's voice was firm. You are going to be fine. I am going to fix this. She meant it. She believed it. The wound was bad, but manageable. She had done this procedure dozens of times in training, but training dummies do not go into shock, do not have blood pressure that drops too fast, do not have complications that textbooks do not warn you about. Miller's pressure dropped. Sara compensated, pushed more fluids, increased the transfusion rate. His oxygen levels fell. She adjusted the ventilator, checked the chest tube placement. Everything was right. Everything should have been working, but it was not working. Miller's heart rate spiked, then dropped, then spiked again in an irregular rhythm that made alarm bells scream in Sara's head. She called for Major Park. He appeared beside her immediately, assessed the situation in seconds. VFib, start compressions. Sara started chest compressions, counting in her head, pushing down with both hands, trying to restart a heart that was giving up. Miller's eyes had closed now. His face was pale. His lips were turning blue. Charged to 200, clear. The defibrillator shocked Miller's chest. His body jerked. The monitor showed no change. Again, 300, clear. Another shock, another jerk, still nothing. Sara kept compressions going. Her arms burned. Her mind raced through every option, every possible intervention. Major Park's voice was calm, but final. Time of death 1347 hours. No, Sara did not stop compressions. No, he cannot be dead. I did everything right. I did everything. Lieutenant. Park's hand on her shoulder. He is gone. You need to stop now. Sara stopped, looked down at the body on the table. The chest she had been trying to save. The soldier who had trusted her to fix him. And she realized something that no amount of training had prepared her for. Sometimes you do everything right, and they still die. She walked outside, made it 3 steps, collapsed, and broke. Sara sat against that supply crate for 20 minutes crying into her hands. Other soldiers walked past. Some looked sympathetic. Some looked uncomfortable. Some looked judgmental. In a mess tent later that evening, the medics talked in voices they thought were quiet enough. Did you see Lieutenant Chen? Completely fell apart after losing Miller. First death is always hard. Yeah, but crying outside where everyone can see. That is not professional. Combat medics cannot afford to break down like that. She is too soft. Should have stayed in a nice safe hospital somewhere. Sara heard them. She was sitting 3 tables away. They did not realize how well sound carried in those tents. She wanted to defend herself, wanted to explain that she was not weak, that she had just needed a moment to process losing someone. But the words stuck in her throat, because part of her wondered if they were right. Maybe she was too soft, too emotional, too attached to patients who were supposed to be casualties, not people. That night Sara lay in her bunk staring at the ceiling of the tent, unable to sleep, replaying every moment of Miller's death, analyzing every decision, searching for the mistake she must have made. Major Park found her in the medical tent at 00 hours. She was reading through Miller's chart for the 10th time. Lieutenant, you need to sleep. I missed something, sir. There had to be something I could have done differently. Park pulled up a chair, sat down beside her. You want to know what you missed? Yes, sir. Tell me what I did wrong. Nothing. Park's voice was firm. You did everything right. Miller's injuries were catastrophic. He lost too much blood before he got to us. Even if we had a full surgical team in a level 1 trauma center, he might not have made it. Then why did he die? Because sometimes people die, Lieutenant. That is the part they do not teach you in medical school. That you can be brilliant and skilled and do everything perfectly. And sometimes it still is not enough. Sara's throat tightened. How do you handle it, sir? How do you keep going after losing someone? You remember why you are here. Tomorrow more casualties will come through those flaps. Some you will save, some you will lose. But every single one deserves a doctor who will fight for them. Even if it hurts. Even if you cry afterwards. Especially then. Park stood up. Get some sleep, Lieutenant. Tomorrow you get another chance to save lives. Sara tried to sleep, but the guilt and doubt stayed with her. The feeling that she was not cut out for this, that the whispers were right, that she was too weak for combat medicine. Morning came too soon. 600 hours. Sara dragged herself out of bed, went through the motions of breakfast, reported for duty with hollow eyes and a heavy heart. Major Park was waiting for her. Good, you are here? We are short-staffed today. I need you ready. Sara nodded. Yes, sir. I am ready. She was not ready. Not really. But she was there, and sometimes that was all you could be. At OE for 7 hours, the radio crackled to life. Mass casualty event. IED hit a convoy. Multiple vehicles. 12 casualties inbound. ETA 10 minutes. Sara felt her stomach drop. 12 at once. The day after losing her first patient. She looked at Major Park. He looked back at her with steady eyes. "You can do this, Lieutenant. I know you can." Sara took a breath, nodded, moved to her station. And when those casualties started arriving, she discovered something about herself. The tears could wait. The doubt could wait. The guilt could wait. Right now, soldiers needed her, and she would not let them down. The first casualties came through at 0857 hours for stretchers. All critical. Blast injuries, burns, shrapnel wounds, bleeding everywhere. Sara took the first patient, Sergeant Davis. Massive bleeding from the leg. Possible arterial damage. Her hands moved automatically. Tourniquet, pressure. Assess the wound. Start for fluids. She did not think about Miller. Did not think about yesterday. Just focused on the soldier in front of her who needed her to be perfect. Next patient. Corporal Lee. Chest wound. Difficulty breathing. Possible pneumothorax. Chest tube. Monitor vitals. Adjust oxygen. Keep him stable. Next patient. Private Washington. Burns across 40% of his body. Screaming in agony. Pain management. Fluid resuscitation. Sterile. Dressings. Calm, reassuring voice, even though inside she was terrified. The casualties kept coming. 12 became 14 when the soldiers deteriorated during transport. 14 became 16 when delayed symptoms appeared. Sara worked without stopping, without breaks, without eating or drinking. Major Park worked beside her. Other medics rotated in and out, taking brief rests. But Sara kept going. At R4, her hands started cramping. She ignored them. At R8, she was running on adrenaline and willpower. Her back ached. Her feet throbbed. Her eyes burned from exhaustion. But soldiers kept coming, and Sara kept saving them. She intubated a soldier whose airway was closing, performed an emergency thoracotomy on another whose heart was failing, stitched wounds, set fractures, monitored vitals on 6 patients simultaneously. The other medics watched her work with growing respect. This was not the lieutenant who had cried yesterday. This was someone else, someone stronger. At R12, they lost power briefly. Emergency generators kicked in, but for 30 seconds the monitors went dark. Sara kept working in the dim emergency lighting, checking pulses manually, counting breaths, adjusting his by feel. When the power came back, other medics realized Sara had not missed a single beat. She had just adapted and kept going. At R14, they ran low on O-negative blood. Sara donated her own pint. Went right back to work while the needle mark on her arm still bled. At R16, the last patient was finally stabilized. All 12 original casualties. All for secondary casualties. All alive. All stable enough to evacuate to better facilities. Sara stood in the middle of the tent, swaying slightly, covered in blood that was not her own, exhausted beyond anything she had ever experienced. Major Park approached her. "Lieutenant, you need to sit down before you fall down." "Are they all stable, sir?" "Every single one." Park's voice was thick with emotion. "You saved them all, Sara. All of them." Sara nodded. Then her legs finally gave out. Park caught her before she hit the ground. Sara woke up 8 hours later in her bunk. Someone had removed her boots, covered her with a blanket, left water and food beside her bed. Her body ached everywhere. Her hands were stiff. Her back screamed when she tried to sit up. But she was alive. And more importantly, every patient from yesterday was alive. She walked to the medical tent, found Major Park doing paperwork. "Sir, I am ready for duty." Park looked up, shook his head with a small smile. "You are off duty for the next 24 hours, Lieutenant. That is an order. But, sir, you worked 16 hours straight, donated blood, saved 12 lives. You have earned rest. Take it." Sara hesitated, then asked the question that had been bothering her. "Did anyone say anything about yesterday? About me crying?" Park's expression hardened. "A few people said some things. I corrected them. Explained that having emotions does not make you weak. It makes you human. And that your humanity helped you connect with those patients. Fight for them harder than someone who did not care would." He stood up, walked over to her. "The mark of a good doctor is not whether you cry when you lose someone. It is whether you show up the next day and try again. You did that. You showed up, and you saved every single soldier who came through those flaps. That is strength, Lieutenant." That is courage. Sara felt tears welling up again. But these were different tears. Not grief or shame. Relief and pride. The whispers stopped after that day. The medics who had questioned her went quiet. The soldiers who had mocked her looked at her differently. She was not the weak lieutenant anymore. She was the doctor who worked 16 hours straight, who saved 12 lives in one day, who proved that crying after loss did not mean you could not fight like hell for the living. Word spread through the base. Soldiers started requesting Lieutenant Chen specifically. Said they felt safer knowing she was on duty, that she cared enough to fight for them. 6 months later, Sara received a commendation for her actions during that mass casualty event. But the words that mattered most came from Major Park in a quiet moment. You asked me once how I keep going after losing patients. I will tell you the truth now. I think about doctors like you, ones who care so much it hurts, who cry when they lose someone because every life matters to them. That is the kind of doctor who saves lives. That is the kind of doctor we need more of. Sara thought about Private Miller sometimes. The first patient she lost. The one she could not save despite doing everything right. She did not think about him with guilt anymore. She thought about him as a reminder that every patient after him deserved the same fight she gave him, the same dedication, the same refusal to give up. And if she cried after losing someone, that meant she had cared enough to try, that her heart had not become hardened by the work. That was not weakness. That was exactly what made her strong enough to show up the next day, to fight for the next soldier, to save the next life. Years later, when Sara was teaching young medical officers, she would tell them Miller's story, not to scare them, but to prepare them. You will lose patience. It will hurt. You might cry, and that is okay. Let yourself feel it. Then wake up the next morning and save the next person. That is what being a combat medic means. Caring enough that loss hurts. Being strong enough to keep going anyway. The young doctors would nod. Some understood immediately. Some would learn the hard way like Sara did. But they all learned that tears and strength were not opposites. They were partners. One made you human, the other made you heroic. And Sara Chen proved that you could be both. Showing emotion is not weakness. It is proof you care deeply enough that loss matters. And caring deeply is what makes heroes fight harder, love stronger, try again despite the pain. Sara Chen proved that you can cry after loss and still be the strongest person in the room. That vulnerability and courage are not opposites but partners. That the doctors who feel the most are often the ones who save the most. Subscribe so you never miss these stories of courage found in unexpected places. Tell us in the comments, have you ever been called to emotional? Sometimes the people who feel the deepest are the ones who fight the hardest.